Welcome to the Corner Perspective. Hi, I'm Bruce Spangler, CEO of the Volunteer Ministry Center, located on the corner of North Broadway and Fifth Avenue. The Volunteer Ministry Center is dedicated to ending and preventing homelessness. Today, I'm honored to be joined by Rachel Ross. Rachel, welcome to the Corner Perspective.
Nice.
Gosh, you do some great work, but tell us what you do.
Well, I'm a licensed clinical social worker, and for the last 5 years, I have been over at the Vine School Health Center. It's a joint project with the College of Nursing and Knox County Schools, and it's an integrated health-based clinic embedded in the school systems.
Okay. But you're here on the campus Volunteer Ministry Center today.
Mm-hmm.
We normally don't work with children.
That's right.
So why are you here?
I was asked here today to talk about adverse childhood experiences and really about how those experiences play into adulthood.
Yes.
Mm-hmm.
For those that we serve, we need to be mindful of how those adverse experiences impact their lives, impact how we engage them as well, right?
Yes. I think it's harder with adults to remember that the things that happen in those early foundation years, 0 to 3, really do impact people over their lifespan. And I think it's really hard to kind of remember that those early experiences or lack thereof really shape how people attach and engage and interact or are able to do things in their adulthood.
Mm-hmm. You gave us an excellent example, an illustration of how the brain acts. Would you share that with us, if I may?
Yeah, sure. It's just the hand model of the brain, and Daniel Siegel is actually the one that kind of started it. And I use it with children and adults because helping the brain make sense helps us understand why we do some of the things we do. And basically, all our information is inputted in our bottom part of the brain, which when I'm talking to kids or even adults sometimes, I like to call our reptile brain, which is just, this brain is in charge of like all our natural functions of just like breathing and sleeping and just regulating our system. So all that information is taken in there, and then when we open it up, we have what our limbic system is, which really, fancy word for just our emotion brain.
Sure.
And this kind of like takes all that information in that we've got in from our bottom part of the brain and goes to our emotions part of the brain, and our emotion and our bottom part of the brain are really trying to work together to say, am I safe? Is this a good place environment? Is everything okay within my environment? And then the last part, which is the big part of the brain, which we like to call our thinking brain, which is the prefrontal cortex, which just really is in charge of making those decisions and thinking about the information that has been inputted in our other two parts of our brain. Oftentimes what happens when people experience early childhood experiences or adverse childhood experiences, this part comes dysregulated. And it really is hard to keep our thinking part of the brain when we have dysregulated thoughts or feelings in this bottom part, and our lid can be flipped.
Mm-hmm. So is it appropriate to think about that? I think it's appropriate to think about that the experience of homelessness is an adverse experience. So when folks are coming to us who are experiencing homelessness or on the verge of experiencing homelessness, that lid can be flipped in some ways, right?
Absolutely. Homelessness is definitely an adverse experience for anybody to experience. And when you come in and you're that dysregulated because your basic needs are not being met, and then the way you are handling that and processing that in your emotion part of the brain makes it very hard for your prefrontal cortex or that thinking brain to stay intact because you're just not able to think about anything because those basic needs haven't been met.
You have shared with us some techniques and ways to kind of be present with folks during those times. Could you talk about a couple of those?
Well, I think it's just like the importance of sometimes like validating and listening and really truly emotionally being present with them while they're going through such a hardship. And I think some of the things that you can do is just what I call name and tame, which is just kind of be able to say what the emotion is putting in front of you, and being able to validate what's being said to you. Another technique that we use quite a bit is just like modeling co-regulation. So if somebody's really overwhelmed, we often sometimes say, can we calm down or can you just relax? And that's not always easy to do if your lid's been flipped. So taking a deep breath with somebody and naming what's going on, like, I feel really overwhelmed right now, and I can see that you are too. That's a nice way to kind of help people regulate and be able to have that cortex or thinking part of their brain come back with you and be in the present with you in the moment.
Right. With childhood adverse experiences and even adverse experiences in adulthood, does that mean I'm doomed?
Well, we like to say in the training and doing that these are just facts, not fate. Because you can experience negative or adverse experiences throughout your life, but really the fact of it is that's just something that happened to you, not who you're going to be. There are things that we can do, things that we can put into place that help you overcome or repair the adverse experiences that have been happened to you. So we just like to say it's facts, not fate.
Right. Well, very, very well said, because the adverse experience of homelessness, we say the remedy is housing.
Mm-hmm.
And so that is what we do here. And for folks who are maybe near homelessness, we do everything we can to provide a presence as well as some resources to help them maintain housing. So, because the desire is that for everyone live to their fullest human potential.
Mm-hmm. Yes, I think we're in the same goal. I'm just working on the other end, and you've got the adult end.
Absolutely. Well said. Well said. Well, thank you for joining with me on this
Thank you. It's very
episode of
nice.
The Cornered Perspective. And yes, thank you for joining with us, and hope that you'll join us next time as we talk about the issues relative to ending and preventing homelessness.